something that I suppose you kind of see in like movies and all this sort of stuff is someone will say, I'm 3 years sober or I'm 2 years sober. And is it the case that I suppose you have to be confident to fully give up something forever? Or can you just almost be confident to not depend on it as much? Because I suppose if we look at like the Hollywood version of people who've got over addictions, they quite often talk about, I'm 2 years sober or I'm 3 years sober. But potentially, I imagine that could be almost more daunting for someone who's in that situation to have to think that they almost completely black and white have to get rid of it forever, as opposed to more thinking of ways that they can more healthily manage with, say, the urges.
Yes, I think it's important not to get stuck in a black and white approach, and this brings up some of the difference between an AA or Alcoholics Anonymous model and what's called a relapse prevention model. Now, one of the downsides of an AA model, where people are saying, once an alcoholic, always an alcoholic, if you have just a sip of alcohol, then you might completely go backwards. Then the problem with that is that people can feel that they've gone completely backwards to the start if they have one lapse or one slip-up. And that's where there's another approach called the relapse prevention approach, which is recognising that, maybe 90% of people who are successful at quitting alcohol, for example, or really curbing the addiction, will have had lapses along the way. So the idea of a relapse prevention model is that people can get more confident of building on the changes that they've made. You could call it more of a growth mindset, if you like. If the person's gone for 3 months and then had a slip, and then gone for 6 months and then had a slip, or they've developed more ways of dealing with urges and getting through them, then that can give people a more gradual building of confidence rather than an all or nothing situation where they just have to be so on top of it that they never have a single lapse. That can put too much pressure on, and it leads to what we call the abstinence violation effect, where the person thinks, hey, I was meant to be abstinent, I've violated that, I've really crossed the line, now I'm back to the start, and then people are more at risk of giving up.
Well, I suppose cigarettes are an example where you quite often hear people quitting cigarettes. They'll sort of say, the first time I quit for 2 weeks, and then the second time it was 2 months, and then I was able to quit forever after that. So I wonder if that's an example of where people almost build up that level of kind of quitting. So what exactly is involved in the relapse prevention model?
Well, the core of the relapse prevention model is urge surfing. So that notion of anything that helps people ride out those urges again and again and again so they get more confidence of managing with that. But in order to look at that, it takes into account the stage that people are at in making a change in their behaviour, because you actually have to be pretty motivated, as you can imagine, to look to ride out those urges when that can be very difficult to resist. And so the stages that model looks at, first of all, the pre-contemplation stage, recognising before people are really acknowledging that there's a problem, and that's where they might benefit with getting information about the problem and how it might be impacting on them. Then there's a contemplation stage where the person thinks, hey, look, maybe there is something I should do about this problem. Maybe it is a problem, and that's where some kind of encouragement or support to take a next step might make a difference. Then the preparation stage is where someone is working up towards some kind of action. For example, they might look up some self-help material, or they might book in to see a psychologist. They're taking some kind of step. But then the key happens at the action stage, and I'll describe some of the techniques in more detail later on. But the action stage basically means the rubber hits the road. The person's doing things, using a range of strategies to help ride out their urges again and again and again so they become lesser. But then even once someone's taken that action, just say if they've quit cigarettes for a couple of weeks, well, big deal, they can go right back on that, but it's maintaining the changes for at least that 4-month period to have any confidence that this is a lasting change. A whole lot of a relapse prevention model is about how can people not just get off a drug, but stay off a drug, for example. But then part of the stages of change is maybe a lapse, because many people who succeed will have lapses on the way. I'd say 90% would. And so the idea is a lapse is normal, but a lapse is not a relapse. The thing is really looking back when someone's had a lapse and looking at what contributed to that. What can I learn from that? That's what I call learning to use lapses as a lever. And then hopefully responding to the lapse, it's not just giving up with that abstinence violation effect. It's then redoubling one's efforts at the action and maintenance stage.
And so practically, what can people do? Are there any sort of practical tools or strategies that people can use?
Well, I think one of the main things is monitoring. Like just say with quitting cigarette smoking. If people are counting up the number of cigarettes that they have a day and writing that down, or counting up the number of standard drinks carefully and writing that down, preferably right at the time that they've just consumed a drink. Now, what that means is there's an incentive the person will have to write 0 for that day. And then you start to get a dopamine boost, anticipation of future reward, if you have days where you write down 0. So monitoring, I think, is really important. Another thing is what we call stimulus control. Not have so much exposure to the problem. So not buying cigarettes or having them around. It might be with alcohol, not having alcohol in the house. It might be not driving past a casino on the way home, taking a different route so you're not so tempted, or not driving past a bottle shop. So we can influence our exposure to the problem. But ultimately, what I see when people go best is that they're really clear on their reasons for change. They've really thought about what are the advantages of quitting, having thought of the advantages of keeping on going, like in terms of trying to self-medicate for distress or the social lubrication. If people think, well, okay, they're the advantages, but what are some of the disadvantages of continuing on, for example, with this alcohol problem? And then developing a mantra. In other words, a self-statement that people can use, such as hold on, or let time pass, or I can do this. But just some kind of form of getting by, getting through it. I'm okay. Something like that to deal with an urge. But again, that strategy of some self-talk is really to recognize that the urge can be there. It can be difficult to resist, but recognizing the intensity can build up. It'll tend to level off and then come down, and doing that again and again and again. And it's when the person develops more confidence of that happening that's when change will tend to occur.